Hi, this is Dr. Mark Taylor at the Gateway Aesthetic Institute and Laser Center in Salt Lake City. In the short video that is to follow, I would like to introduce you to some new products and also a technique that we use to treat the laugh lines, the hollow tear troughs, and also unevenness on the nose. Please watch. I think you'll enjoy it. This is a beautiful young woman who has requested some enhancement procedures for the laugh lines, tear troughs, and also the nose. These products are from Revance. The Teoxane RHA 4 is being used here, and we are going to enhance the appearance of the laugh lines. My technique is to use the fewest number of pinpricks possible in order to perform the procedure. The little device that you saw is a distractor that makes it so that it's difficult to even feel the pinprick. Here in this video, I'm using my hand to compress and contain the filler in the laugh line rather than having it go laterally either toward the lip or out toward the cheek. This makes the improvement from the filler much more predictable, and using my smart hand I can tell where it is being placed and what volume is going into the laugh line. Now we've filled the deep dermis and we're going now in the superficial dermis. This helps to evert the wrinkle in the laugh line. Always aspirate to make sure that we're not in a vessel, and then once again as we withdraw and feel with the smart hand what is happening, we fill in the superficial part of the laugh line wrinkle. Now there is also a technique we use to massage and blend and make sure that we have an even filler in the laugh line at the end of the injection. Now there are a couple little tiny lines right at the lateral commissure, the little wrinkle right to the side of the corner of the mouth, and we put just a little bit of filler very superficially just underneath the epidermis in this area, and also blend and massage that as we finish doing that technique. Now we'll go to the other side again. Notice the little vibrator that we use to distract the patient. This patient has had no numbing cream or other anesthesia, and with this technique it's possible to do the treatments with minimal discomfort. Here we are once again doing the deep dermis and compressing each side of the groove to make sure that we keep the filler in the most important part of the laugh line trough. As we withdraw, we can feel the volume that is being injected, and by compressing each side we keep that in the right plane. Now we're going back in without doing any more injections or any more needle sticks, and going a little bit more superficial this time, and we're filling in the more superficial wrinkle that is associated with the laugh line. Here we're injecting very slowly. This is a very nice product, has a nice flow, and so it's easy to control how much product is going in and where we put the product. Here again we're blending the product using the index finger inside the mouth and the thumb on the outside to blend and mold and make sure we have a nice even correction with this product. This is the Teoxane RHA 4 product from Revance. Now the next thing we're going to do is to enhance the hollowness of the tear trough, which isn't severe in this patient, but it's just enough that it bothers her a bit. We've just made a small entry point with a trocar, and now we're using a cannula. Again, I like to do these techniques with the fewest number of sticks, and so here we're doing a cannula, and we can do the entire tear trough through this one single entry point. So we're going along, putting a little bit of product, first medially next to the nose, then we do under the eye, and then a little bit lateral in this groove out to the side of the eyelid orbit. And you can feel as this product is being injected, it's very smooth and very easy to control. And then we will do a little tiny bit of molding to make sure that everything is nice and even. She'll put a little pressure on this area while we go to the other side. Again, we use our little distractor while we make the entry point with the trocar. Then we get our cannula again. And the nice thing about this cannula is it's blunt, and so there's a very, very low risk of injecting any product into a blood vessel, which can cause some side effects if the product isn't injected into a blood vessel. So with a blunt cannula, we have really good control, very low risk of bruising, very low discomfort level, and very easy to control the depth and location of the product that we are injecting. Here we're first do the medial or inside area next to the nose, then right underneath the eye, and then to the lateral groove just outside of the orbit. We are now done with that injection, applying a small amount of pressure. And then the final procedure we're doing here, after doing the eyelids with RHA2, we're now back to RHA4. And this beautiful young patient has just a tiny bit of a depression toward the lateral 1/3 of her nose. So we're going to fill that in to give the nose a smoother profile. We always are very careful to aspirate to make sure that the product is not in a blood vessel. And again, inject a small amount, we mold that. And then there's one more area that we're going to do just a tiny bit more in. So we do the same technique, use our vibrator to distract the patient from the initial pinprick. We aspirate to make sure we're not in any blood vessels, and then inject, and again using the fingers to maintain the product in the area that we want. This whole procedure is very quick with minimal downtime and minimal recovery at all. This patient, here she is, after all of the 3 procedures, the laugh lines, tear troughs, and the nose. Thank you so much for watching.